We are excited to welcome you to Hennepin County. As part of our skilled and dedicated workforce, you have access to the total rewards that make Hennepin County a great place to work. This session will provide an overview of the total rewards available to you. You can review more detailed information in your new employee benefits guide or visit the county's total rewards website, The Bridge, available at bridge.hennepin.us. Hennepin County Total Rewards provide you support for your whole well-being, including your physical, emotional, social, and financial health. These benefits include our Health and Wellness Program, which offers medical, dental, and vision coverage, as well as a robust wellness program. The Work-Life Balance Program provides you with time away from work through paid time off or vacation and sick leave, paid holidays, and leaves of absence. The Retirement and Savings Program offers you multiple ways to save for your future, including a pension plan, a healthcare savings plan, and a retirement savings plan. And lastly, the insurance program provides you with financial protection through life insurance and disability coverage. We'll review each of these programs in more detail throughout this presentation, starting with the Health and Wellness Program. The Health and Wellness Program offers benefits to help you care for yourself and your loved ones, to build and lead a healthy lifestyle, and to prevent and manage chronic health conditions, providing you with robust resources that support your total well-being along the way. As a new employee, you have 30 days from your date of hire to enroll in healthcare plans. Your costs for the benefits you enroll in are deducted from your paycheck on a pre-tax basis. The benefits you select are effective the first of the month following your date of hire and will continue through December 31st. Each fall, during open enrollment, you will have an opportunity to change your elections for the following year. You can change your elections during the year only if you experience a qualifying life event, such as getting married or divorced, giving birth, or adopting a child. As a benefits earning employee scheduled to work 20 or more hours a week, you can enroll in healthcare coverage for yourself, your spouse, and your dependent children ages 25 or younger, including stepchildren and dependent grandchildren. You may also cover disabled children who are aged 26 or older. You are required to submit documentation that verifies your dependent's eligibility before you enroll them. A list of required documents is available in your benefits guide.
The county's medical plan is administered by UMR, which is a subsidiary of United Health Group. For 2023, the county has updated its medical plans so they all offer identical coverage. When you enroll, you'll be asked to select a plan. But because the plans are the exact same for this year, you'll receive the same coverage, access to the same network of providers, and pay the same cost regardless of the plan you choose. Administratively, you'll be asked to select either the standard plan or an advantage plan, but because they are all identical for this year, you're really choosing whether you want to enroll and who you want to cover. There is no difference between the plans in which doctors you can see when you need care, how much you pay in premiums from your paycheck, or how much you pay out of pocket when you visit the doctor. The plans are all identical. Let's take a closer look at how the health plan works. Key features include 100% coverage for in-network preventive care. This includes well child visits, annual wellness exams, and preventive screenings like mammograms and colonoscopies. There's 100% coverage for mental health care office visits, both in-network and out-of-network care. There's free virtual care for minor conditions, dermatology needs, and mental health care through Teladoc. You have the ability to see specialists without a referral. The plan includes coverage for prescription drugs. You pay a copay depending on the type of drug that you need. There's no deductible when you visit an in-network doctor for care. And lastly, as a new hire, you do not pay a copay for in-network office visits because you automatically receive the health incentive for this year. The health incentive reduces your copays when you visit a doctor. As a new employee, if you enroll in the health plan, you automatically receive the health incentive for this year. which is up to $20 in reduction off your office visit copays. If your hire date is after August 1st, you will also receive the incentive in 2024. If you start before August 1st, you must earn 3,000 wellness points by October 31st to earn the health incentive for 2024. Wellness points can be earned in a variety of ways, including registering an account with UMR or Teladoc, completing a clinical health risk assessment, receiving preventive exams, participating in wellness events or challenges, tracking healthy habits such as your daily steps or fitness activities. A full list of information is available on the LiveWell portal, which is online at umr.com. You can register for your account after you receive your medical ID card in the mail. It's also important to note that if you cover a spouse on your medical plan, both you and your spouse each must earn the 3,000 wellness points by October 31st to receive the family health incentive discount. In addition to the health incentive program, you also have access to a robust wellness program that is designed to help you and your family live healthy, balanced lives at work, at home, and in the community. The wellness program includes options to care for your body and mind because the healthier and stronger we are as a workforce, the better we are able to serve our clients and community. The wellness program is flexible, meeting you where you're at on your wellness journey and providing a variety of options to maintain, manage, or improve your health. Highlights of the program include online health and wellness classes, health coaching on a variety of topics from sleep to nutrition to health conditions and more, a well-being platform with online activities and tools available through UMR's LiveWell program, mental and emotional health programs and resources, an online weight loss program if you're enrolled in the county health insurance plan, support for tobacco and substance use, as well as wellness events throughout the year. Depending on your needs and preferences, you can find resources that cover a variety of topics, locations, and delivery channels, such as in-person, by phone, or online. More information is available on the bridge.
Trade Time for Fitness is a program that gives you the flexibility to trade your PTO or sick leave balance for fitness-related expenses. You can get reimbursed for up to $2,000 of eligible expenses, such as health club memberships, fitness equipment, fitness classes, or personal trainers, and more. Your PTO or sick leave balance will be reduced by the equivalent cost based on your current rate of pay. You also have the option to enroll in dental coverage administered by Health Partners. This plan offers 100% coverage for preventive care, including cleanings, x-rays, fluoride treatments, and sealants. 100% coverage on services for children ages 12 and younger when they receive in-network care. Coinsurance with amounts that vary based on the type of procedure, and orthodontic coverage for children ages 18 or younger. Some unions offer separate coverage through Health Partners. If you are eligible, you will receive details from your union. It's also helpful to know that if you enroll in medical coverage through Hennepin County, your plan includes preventive care for dental services for children ages 18 or younger. If you enroll in the dental plan, the coverage you receive is based on the network of your dental provider. Providers who participate in the Health Partners Dental Network are included under Benefits Level 1. Services at these providers will have lower out-of-pocket costs, including no deductible. If you see a provider in Benefits Level 2, your deductible is $25 per person, up to a family maximum of $75. And some services, such as fillings, have higher coinsurance. Find a dentist near you by using the provider lookup tool at healthpartners.com/Hennepin. The Vision Plan, insured by IMED, provides coverage for frames, lenses, and contacts to help you see clearly. Each calendar year, you have a $175 allowance on frames. You also receive a lens benefit. You can choose to either pay a copay on eyeglass lenses or receive a $175 allowance on contacts. You only receive one lens benefit, which means if you use the contact lens allowance, you are not eligible for the eyewear lens copay and vice versa during that calendar year. It's also important to note that the vision plan does not include your eye exam. Your eye exam can be covered by your medical plan, so it may be helpful to find a vision provider in both your medical and vision plan networks. Visit imedvisioncare.com/Hennepin to look up providers in the iMed network.
Another component of the Health and Wellness Program is the Expense and Spending Accounts, also known as Flexible Spending Accounts or FSAs. These accounts allow you to set aside pre-tax money each year for specific expenses. There are three types of expense and spending accounts. The first is the Healthcare Expense Account, also known as the Healthcare Flexible Spending Account. This account allows you to save up to $2,850 this year to use on medical, dental, and/or vision expenses. Eligible expenses include copays and coinsurance, prescription drug costs, eyeglasses, dental work, braces, and more. The second account is the Dependent Care Spending Account. This account allows you to save up to $5,000 in pre-tax money each year to use on eligible child care expenses such as daycare and after-school programs. You can also use this account to pay for qualifying elder care. The third account is the Adoption Spending Account. If you are planning to adopt a child, this is an opportunity to save pre-tax money and use the funds on adoption expenses and fees. You can save up to $14,890 in this account this year. These accounts are governed by IRS rules, including the use it or lose it rule, which means the money you put into the account but don't spend by the year-end deadline may be forfeited, so plan carefully. It's also important to note that any contributions you or your spouse made to an FSA through another employer count toward your annual maximum, so please take that into an account when setting up your contributions. Once your account is set up, you'll receive a debit card in the mail that you may use to pay for expenses at the time of service. You'll also receive information to log into your account online where you can view your balance, submit expenses for reimbursement, and more. More information about these accounts and eligible expenses is available in your benefits guide or on padmin.com/Hennepin-County. You also have access to an employee assistance program through Deer Oaks EAP. This program offers many services, including short-term counseling on a variety of topics, such as financial, family, work, or other personal concerns. These counseling sessions are confidential one-on-one meetings, either in person or by video or phone. The EAP also provides access to work and life referrals. You can use this referral service to find providers for elder care, child care, pet sitters, home repair services, tutors, and more. You can also take advantage of financial and legal resources available through the EAP. This includes a free 30-minute phone consultation with a plan attorney, interactive online will preparation, and unlimited phone consultations with an accredited financial counselor for issues such as bankruptcy prevention, debt reduction, financial planning, and identity recovery. The Work-Life Balance Program at Hennepin County provides you with time away to help you balance your home and work life, giving you time to rest and recharge and to take care of personal needs. Whether it's spending time with family on vacation, celebrating holidays, recovering from an illness, or caring for your loved ones, time away is available to help you focus on the things that matter most to you. The Work-Life program includes paid and unpaid time away. Paid time includes paid time off, also referred to as PTO. If you are in the LELS Sheriff's Supervisor Union or IBEW 292, you'll receive a combination of sick and vacation time instead of PTO. All other employees receive PTO. You can save up to 480 hours of PTO. Once you reach the maximum, you stop accruing additional time until you use some of your time off and reduce your balance. You also receive 12 paid holidays each year, including 1 day of floating holiday leave with pay. This holiday leave with pay becomes available in December of each year and can be used at any time during the year. Other paid time away includes 12 weeks of paid parental leave, up to 480 hours. This is available for both the birth and non-birth parents. You also have access to up to 48 hours of paid bereavement leave if you experience the death of a family member. And then finally, you also receive paid time off for jury duty and military leave. If you need additional time away, you have the option to apply for family medical leave, personal leave, or special leave without pay. If your role at the county is a remote or a hybrid position, the county will provide you a one-time $500 payment to offset the costs of securing high-speed internet and help you create a home office space where you can be efficient and productive. You will automatically receive the payment after completing 6 months of employment. The county also pays an employee referral bonus of up to $500 for each referral that is hired into an open competitive position. If you were referred to Hennepin County by another employee, please complete the employee referral bonus form in Apex when you're completing your other new hire forms. This form is only available for the first 2 weeks after you start, and it's the only way the referring employee receives the bonus payment. So please complete this form if it applies to you. Also, please know that you are eligible to receive employee referral bonuses yourself. If you see an open job posting here at Hennepin County and know someone who may be a good fit, go ahead and share the posting with them. If they are hired, you're eligible for that bonus.
The Retirement and Savings Program helps you build toward your financial and retirement goals, allowing you to reach your future dreams. There are 2 components to the Retirement and Savings Program: required savings and voluntary savings.
The first required savings program is the Public Employees Retirement Association Pension Plan, or PARA. PARA is the pension plan that you automatically participate in. You in Hennepin County make automatic contributions to the plan. These contribution amounts are shown on the screen in the table on the right. Most employees contribute 6.5% of their pay to PARA, with the county making a 7.5% contribution. Correctional and police and fire employees are also shown. Your PARA funds will be available to you as a pension when you retire. This pension is generally paid as an annuity or a monthly payment throughout the remainder of your life. Please note that vesting rules do apply. Most plans are vested at 5 years. If you leave the county before you are vested, you will lose the county's contributions, and you may request a refund of your contributions. Also note that if you have PARA service credit from another organization, PARA will automatically merge your accounts on your behalf. Watch your mail for a welcome packet from PARA. This will include more details on your PARA account and information on how to log into your online account, where you can access tools to estimate your pension payments in retirement and more. The next required savings plan is the Healthcare Savings Plan. This plan provides you with savings for healthcare expenses when you retire or leave the county. Note, if you are a limited duration employee, you do not participate in this plan. Most employees will automatically contribute 1% of their pre-tax pay to this plan. The contribution amounts are set. You cannot contribute more or less. The money is deposited into an account that you can access when you retire or leave the county, and it can be used for healthcare-related expenses, such as Medicare premiums, deductibles, copays, hearing aids, eyeglasses, dental work, and more. You'll receive a packet in the mail from the Minnesota State Retirement System with more details, including information about how to log into your online account where you'll be able to invest your money into a variety of funds. You also have the opportunity to participate in a voluntary retirement savings program by making contributions to the Retirement Savings Plan, also known as the 457B Deferred Compensation Plan. This is similar to a 401k, but designed for public employers, allowing you to save and invest money for retirement with tax benefits. This year, you can save up to $22,500 in pre- and/or Roth after-tax money. And if you're age 50 or older, you can contribute an additional $7,500. And if you are within 3 years of normal retirement age, you can contribute an additional amount. While the county does not make matching contributions to this account, it continues to be a valuable savings tool with great tax advantages. You are able to withdraw the money in your account when you retire or are no longer working for the county. To enroll in the retirement savings plan, you must first set up an account with your preferred vendor. You have the option of 3 vendors: Fidelity, Voya, or the Minnesota Deferred Compensation Plan. Once your account is set up, you can log into Apex to set up your contributions. More information is available in your benefits guide.
The county offers other savings programs to help you save for expenses and other costs. The first program is the College Savings Plan that allows you to save post-tax for your child's education. Money you invest in this plan grows tax-free. You can also participate in transit plans, such as the MetroPass or GoTo card, to save on commuting costs. The county pays 70% of the cost for either the MetroPass or GoTo card. You can participate in one or the other, but not both. If you drive for your commute, you may also want to participate in the parking spending account, which allows you to save pre-tax money each month to pay for parking expenses. Lastly, you have access to discounts through several partners. Maersk is an employee discount program offering savings on event tickets, park passes, professional services, and more. The Minnesota Benefits Association offers a variety of voluntary benefits, including scholarships, an auto lease and purchase program, and auto and long-term care insurance. Look for more information on these programs, including discounts on childcare, fitness centers, cell phone services, and more on bridge.hennepin.us.
Finally, the insurance program provides income and financial protection for you and your loved ones when you need it the most. These benefits include life insurance and short and long-term disability.
Life insurance is there to protect you financially in the event of the death of you or a loved one. The county automatically provides basic life and accidental death and dismemberment coverage of $50,000. There is no cost to you for this benefit. You may also enroll in additional coverage, including for yourself up to $500,000, your spouse or domestic partner up to $250,000, and your dependent children up to $15,000. You can enroll in these additional coverages at any time. However, as a new hire, you are guaranteed coverage of $100,000 for yourself and $50,000 for your spouse or domestic partner. After the initial enrollment period, proof of good health will be required.
Disability coverage is available for employees who are scheduled to work 30 or more hours per week. This coverage replaces a portion of your income if you become sick or injured and are unable to work due to a non-work related event. There are 2 types of disability coverage. The first is short-term disability. Short-term disability replaces 60% of your income for up to 90 days. This coverage is optional. If you elect short-term disability, you are responsible for paying the cost of coverage. When you enroll, you select a waiting period. If you have an approved claim, this is the amount of time that passes before benefits begin paying. It's also important to note that your benefits will not begin paying until your combined paid leave balance totals 80 hours or less. This includes PTO, sick, vacation, holiday, compensatory, and any other paid leave balances. If you don't enroll as a new hire and you later elect coverage, or if you enroll and you later select a shorter waiting period, you will have a 60-day waiting period for 12 months after enrollment, regardless of the waiting period that you select. You are also automatically enrolled in long-term disability coverage. This is provided at no cost to you. Similar to short-term disability, long-term disability replaces 60% of your income. However, it does not begin paying benefits until a 90-day waiting period is complete.
To elect benefits, you must enroll within 30 days of your hire date. First, take time to review the materials in your benefits guide and on the Bridge website at bridge.hennepin.us. Next, upload your dependent verification information to Apex. Remember, you will not be able to enroll your dependents in your benefits until their eligibility documents have been verified. And finally, once you've received confirmation that the documents have been approved, you can return to Apex and select your benefits coverage. As a reminder, you can find more details about your county benefits, including rates and links to provider lookup tools, in your benefits guide and online at bridge.hennepin.us.
Thank you for your time. Again, we're excited your career has brought you to Hennepin County. If you have questions about your total rewards or how to enroll, you may contact the HR Service Center at hr.servicecenter@hennepin.us or call 612-348-7855.